Okay, so let's talk about our indications for IV therapy. So, intravenous fluid therapy, what does that mean? Well, IV therapy is a treatment that infuses IV solutions, medications, blood or blood products directly into a vein. IV therapy is an effective and fast-acting way to administer fluid or medication treatment in an emergency situation and for patients who are able or unable to take medications orally. Approximately 80% of all patients in the hospital setting will receive. So I think I got cut off there. So approximately 80% of all patients in the hospital setting will receive IV therapy. So the most common reasons for IV therapy include to replace fluids and electrolytes and maintain fluid and electrolyte balance. The body's fluid balance is regulated through hormones and is affected by fluid volumes. You guys know that. Distribution of fluid in the body and the concentrations of solutes in the fluid is what keeps us in homeostasis, right? If a patient is ill and has a fluid loss related to a decreased intake or surgery of vomiting, diarrhea, or diaphoresis, the patient may require IV therapy. To administer medications including chemotherapy, anesthetics, and diagnostic reagents, about 40% of all antibiotics are given intravenously. To administer blood and blood products, the donated blood from another individual can be used in surgery to treat medical conditions such as shock or trauma, or to treat a failure in the production of red blood cells. The infusion restores circulating volumes, improving the ability to carry oxygen and replace blood components that are deficient in the body. Now, the chances of you ever infusing blood or blood products are probably slim, but it is done intravenously, as you know, and it's very precise, tedious, and time consuming, and there's checks, rechecks, double checks, and triple checks. We also use IV therapy to deliver nutrients and nutritional supplements. IV therapy can deliver some or all of the nutritional requirements for patients unable to obtain adequate amounts orally or by other routes. So what are our guidelines related to intravenous therapy? So IV fluid therapy is ordered by a physician or nurse practitioner, well, physician's assistants as well. The order must include the type of solution or medication, rate of infusion, duration, date, and time. IV therapy may be for short or for long duration, depending on the needs of the patient. IV therapy is an invasive procedure, and therefore significant complications can occur if the wrong amount of IV fluids or the incorrect medication is given. Aseptic technique must be maintained throughout all IV therapy procedures, including initiation of IV therapy, preparing and maintaining equipment, and discontinuing an IV system. Always perform hand hygiene before handling all IV equipment. If an administration set or solution becomes contaminated with a non-sterile surface, it should be replaced with a new one to prevent introducing bacteria or other contaminants into the system. Now, some general guidelines. Understand the indications and duration for the IV therapy for each patient. Practice guidelines recommend that patients receiving IV therapy for more than 6 days should be assessed for an intermediate or long-term device. If a patient has an order to keep a vein open, or KVO, the usual rate of infusion is 20 to 50 mLs per hour. Complications may occur with IV therapy, including but not limited to localized infection, catheter-related bloodstream infection, fluid overload, and complications related to the type and amount of solution or medication given. We're going to talk about that in another lecture. For infusing peripheral IV, the site must be assessed every 2 hours in PRN. A saline lock site must be assessed every 12 hours in PRN.